because I haven't looked at my paper or this PowerPoint in about 4 days, so discuss. But my chemical compound was isotretinoin, which is essentially Accutane, as it is most commonly referred to. So its IUPAC name is 2Z4E6E8E37-dimethyl 9266 trimethyl cyclohex 1N1-ol mono 2468 tetranoic acid. Its formula is C20H24O2 with a weight of 300.44 grams per mole. Common names is Accutane, even though Accutane is no longer available in the US because it's been discontinued, but there's also now Accutane, amnestine, Clarivis, Absorica, Isotrone, and Purus Absorica is what I take.
How many times did you practice that?
That?
Yeah.
Like twice.
Oh, okay. That was pretty impressive.
Oh, thank you.
Just kicked it out. Do you know what the Z and E is?
Where?
In the very first part.
Oh, no, I did not.
Those are double bonds. So double bonds have a Z and an E depending on whether they come off on the same side of a double bond or different sides.
Oh. Okay. So uses, it is an oral treatment for severe acne and is normally prescribed after other treatments have failed. The majority of patients, 70%, between the ages of 15 and 24, and 85% of those are male, or 85% of male patients are teenagers and 55% of female patients are teenagers. Then for other historical alternatives for acne treatments, there is therapy, which is the blasting of acne with radiation, pressed toothpaste, abstinence, urine, sun exposure, and arsenic tablets as well, as long as a long list of others, but those are the most fun ones. And then more modern solutions include benzoyl peroxide, salicylic acid, tropical retinoid medicines, antibiotics, and low-dose birth control pills containing estrogen. Other alternatives. That's my favorite. All right. Side effects. Birth defects. Worsen acne for the first 2 or 3 weeks of treatment. Dry lips, dry skin, increased susceptibility to sunburn, like Melcher when he got moonburn while in Accutane. Got burned at night.
Did he really? Seriously?
Yeah, actually. Depression, skin clots, bloody noses, skin irritation, liver failure, and anemia. So history. Basically, it was first discovered in the 1960s as a treatment for skin cancer. It was basically abandoned. Then another laboratory rediscovered it. So that first laboratory then took out patents on it and started actually mass producing it. And then it gained FDA approval in 1982, and it was under the name isotretinoin. And then as it became as it was prescribed more and more, a lot of birth defects started getting reported as a side effect of the drug. So the FDA in 1988 had estimated that 1,000 babies had been born with birth defects, 1,000 miscarriages had been caused, and that about 5,000 to 7,000 women had had abortions due to the side effects they knew they were going to have from having taken Accutane. Then in 2002, the patents for the Roche labs expired, and so other companies started being able to produce it. Quickly, they weren't able to continue it anymore because of low stock values, so they discontinued Accutane, and that's why it's not available in the US anymore. But it's now still under the name brand of Accutane, Absorica, and all that under other manufacturing companies. So the pharmacodynamics. So first off, it's the study of the biochemical and psychological effects of pharmaceutical drugs and the mechanisms of their reactions. So it is a derivative of vitamin A. It is a stereoisomer, which means it's different only in the spatial arrangement of their atoms, of tretinoin, which is a topical acne treatment separate from isotretinoin. The exact mechanism of the action is not known, but clinical improvement is associated with dose-related apoptosis, which is cell death, basically, leading to suppression and the activity of the sebaceous glands. So basically, the sebaceous glands are what are, they form sebum, which combine on the hairs on your skin to basically create an environment in which bacteria can thrive. And so once that's been overproduced, then acne starts forming in that place. So it basically serves to create cell death among the sebaceous glands so that less sebum is produced and therefore less acne. And then the dermal anti-inflammatory effect has been established. They do know that actually about the mechanism, but the rest of it is not known. So in the pharmacokinetics, which is the study of how drugs react moving through the body, So it has a mean biological half-life of about 10 to 20 hours. It undergoes enterohepatic recirculation, which means it goes through the liver to the bile, through the small intestine, and then back to the liver. And so because of this, and the fact that it deals with the liver so much, patients have to have their blood work done for the first 3 months while taking it regularly like clockwork to get the next prescription to make sure that their liver isn't failing. It's another reason that Accutane users aren't supposed to be drinking while they are on Accutane, whether they choose to follow that or not. And then, yeah, exactly, they're at least not supposed to drink.
Most of them are teenagers. Let's hope not too many.
Yeah, exactly. But you know, I hear about like people in the grade who are on Accutane. I'm like, oh, how long have you been on it? They're like, oh, like 3 or 4 months longer than I was supposed to. And I say why, and they go, oh, because I've been drinking the whole time. So, side effects last for approximately 2 weeks to about a month following the end of therapy. And so there's also a requirement for fertile women to continue the use of effective contraception at least 4 weeks following the cessation of treatment, because that's how long side effects can last. I don't know why I put continued on the other side. I think I have them back in this order. But so it's 99% bound to plasma proteins, and it's rapidly absorbed after oral consumption. And so it's supposed to be taken after a high-fat meal, because it gets absorbed better if there's a lot of fat in your system. So the bioavailability is doubled with food, especially high-fat concentration foods. And then the first pass metabolism further reduces bioavailability to approximately 20%. So as it passes through your body, less of it is actually available to you. And then the absorption of isotretinoin is linear up to a dose of 240 milligrams, after which a plateau is seen. So the mechanism. So as I said earlier, the exact mechanism is unknown of isotretinoin, but several studies, as I was saying earlier, basically show that it induces apoptosis, so cell death in sebaceous glands, thus lowering the production of sebum. It is known that isotretinoin has a low affinity for retinoic acid receptors and retinoid X receptors, but it may be converted intracellularly to agonists of RAR and RXR nuclear receptors. So then there's another theory, and I'm just going to be honest and say that I really don't know what this means, so I pretty much copied this from Wikipedia. So just go ahead and read this. Other studies seem to suggest that it may downregulate the telomerase enzyme of H-TERT, inhibiting cellular immortalization and tumorigenesis. In 2007 study, isotretinoin was proven to inhibit the action of melanoprotease, which is something that plays an important role in the pathogenesis of acne, MMP9, which is gelatinase in sebum, without any influence in the action of TIMP1 or TIMP2 and the issue inhibitors of the melanoprotease. So I don't really know what that means, but it was in there, so I threw it in there in case if you were curious. So the industrial synthesis. So this is the image of it, but I will go over what this essentially is. So basically, the Hoffman-LaRoche in 1985, they pulled this off by, so 1.03 equivalents of phosphonium salt, which is this, was condensed with 1 equivalent of hydroxybutanolide, which is that, in this reaction. And in the presence of 1.25 equivalents of 2-NKOH in isopropanol at 3. I'm not even sure how to read that off, because again, it was pretty much just copied over from the paper I found in the patents. For 1 to 1.5 H, the product at 91.5% total yield consisted of 75.9% of the 2-cis-4-cis vitamin A acid, which is that. And was subjected to palladium catalyzed separation, the mixture of 10 and 1, where the other one is actually isotretinoin.
Stop. Wait, go back to it. No.
Oh, sorry.
I don't understand. Oh, okay, so it's just minus 30 degrees. You had 3 zeros. So I was like, there's no such thing as minus 300
Yeah,
degrees.
it actually copied the degree. It copied as a 0.
Okay.
That's what I didn't catch that. But with that separation, the mixture of 10 and 1 was subjected to palladium catalyzed isomerization conditions. The mixture is heated to 50 degrees Celsius for 1 hour in acetonitrile in the presence of 0.1 molar percentage of palladium nitrate. 4 equivalents based on palladium nitrate of triphenylphosphine, and 2 equivalents also based on palladium nitrate of triethylamine, consequently isotretinoin, which is that was produced in 85.7% yield.